Welcome. I'm Liz Beaule, and I'm the Director of Education for the New Hampshire Harm Reduction Coalition. I do all of the overdose response trainings as well as any harm reduction education around the state of New Hampshire, and try to teach people how to stay safe when they're using drugs and when they're keeping their family members safe from that. Today we're going to be talking about overdose response. So this is how to respond to an overdose of opioids. Somebody has too much and we need to make sure that they can come back and we can take care of them and EMS arrives. Overdose response is a lot of things. The most important thing that we'll talk about is rescue breathing, but first we'll go over a quick background of what overdoses are, what opioids are, and how they happen. So what are opioids and what do they do? Opioids mainly target the brain's reward system, flooding the circuit with dopamine. Dopamine is a neurotransmitter present in regions of the brain that regulate movement, cognition, emotion, motivation, and feelings of pleasure. When this system is overstimulated, it shows our brain that we really like that feeling. So people learn how to use drugs in the same way when they repeat euphoric feelings. Our brains are hardwired to ensure that we'll repeat these life-sustaining activities by associating those activities with pleasure or reward. Whenever this reward system keeps getting activated, our brain sees that something important is happening, and we learn how to repeat it. We do it again and again without thinking about it. Because drugs impact the brain's reward system in the same way, we learn how to use drugs in the same way. What is an opioid overdose? So an opioid overdose is as simple as it seems. It's when the body has too many opioids in it. This could be because we took too many doses of our medication, or maybe because we have used illicit substance like fentanyl and we didn't know the dosage that was happening. But basically an overdose occurs when there's too many opioids overwhelming the system and it suppresses our body's urge to breathe. Depending on the type of opioid, the amount consumed, the potency, there's lots of different factors, and any other cuts that could be found within the supply, an overdose can happen suddenly or evolve over several hours. So there's lots of different risks when we're talking about overdose, but the main ones are going to be any change in regular use. That means a loss of tolerance. So if somebody has been released from jail, prison, hospital, detox, or abstinence-based treatment programs, that means their tolerance can change. If people take a break in using and then pick back up again, their tolerance can also change. If maybe they're buying their supply from a different person or a different place, and it's not the same dosage and potency as it was before, then that's also a risk for overdose. If people are using medication-assisted treatment, methadone or Suboxone, then they can also change their tolerance. If they are released from a hospital or inpatient treatment program with these medication-assisted treatments, then they go out onto the street and they use a drug that maybe isn't as safe as methadone or Suboxone, can absolutely be at risk for overdose. There's also some other ones. When we're mixing drugs, if we are using that we think is possibly a party drug like MDMA, but it could have fentanyl in it and we have a fentanyl novice body, that could also be a risk of overdose. If you're sick, you can be at a higher risk for overdose. Things that impact your heart, your lungs, can impact how you breathe and how blood flows through you. And of course, legality. When we're talking about legality, we mean it's always safer to get a supply of a drug you're using from a well-known approved source, something like a pharmacy, than it is to get a drug from an unknown source, somebody selling pressed pills that you don't know what they contain. There are lots of ways to prevent overdose, and I promise they're very simple. Number one, we can carry naloxone in any form. We can know the signs of overdose that we're going to learn today, know how to use naloxone to be able to save someone's life. If we are somebody who consistently uses drugs, especially if we're somebody who uses opioids, it's important to test our supplies. So when we get new amounts of drugs like fentanyl, it's important to test it for the presence of xylazine, which is an animal sedative, which can be way stronger than fentanyl when combined, and there is no naloxone for it. It's important to not use alone when we are using. We want to stagger our use with somebody else, have them try, then we try. We watch each other for signs of overdose. And use the Never Use Alone hotline or the Safe Spot hotline. Both can be found online. You can also go low and go slow. You can always do more, but you cannot do less. So consider doing a little bit as a tester shot and then moving on. You can limit your use while sick. If you have illnesses affecting the heart and lungs, that can increase your risk of overdose. Don't mix drugs. Don't mix alcohol and benzos with anything. This can be a deadly combination. Wait to use if you don't feel in control. And of course, the easy one, stay hydrated. This can prevent illnesses and increase blood flow. If you are somebody who is consistently using opioids, change the way you use. Try injection alternatives like safer smoking or safer snorting. So when an overdose is happening, this is a good example of what's going on in our brain. We have our little macaroni noodle receptors, which are the opioid receptors in our brain. And when opioids are taken into our system, they attach directly onto those receptors, the little green balls. When we have too many opioids in our system, they flood those receptors and they start to suppress our body's urge to breathe. So this is where naloxone comes in. When the medication naloxone is administered, it goes directly into that receptor and essentially kicks the opioid right off of it. And then it sits in that little cup for about 30 to 90 minutes. Depending on the kind of naloxone or opioid antagonist that you use, depends on how long that naloxone will sit in the cup and give your body's urge to breathe back to it. So fentanyl fact and fiction. It's important to know the real facts when it comes to this drug. If you're somebody who uses opioids consistently, you probably have fentanyl in your supply that you're using, so your body's used to it. If you're not somebody who uses fentanyl, that means that you might have a lower tolerance and you could be at a higher risk for overdose. Yes, fentanyl is a synthetic opioid, but no. Touching a small amount of fentanyl will not cause an opioid overdose. Incidental skin exposure to fentanyl is extremely unlikely to harm you. There are things called fentanyl transdermal patches, which is a medical device that's meant to go through your skin and disperse the medication as it's designed to. But they are not the same as getting powder on your hands and having some kind of incidental skin exposure. Transferring fentanyl from skin to mucous membranes, your eyes, your nose, your mouth, is the most common type of incidental exposure. But still, it would have to be intentional, and it would have to be a lot of fentanyl. If a potential exposure happens, wash your hands. Use soap and water instead of alcohol because it could aid in the absorption into the skin. Use a mask and gloves if you want to feel extra comfortable to clean up any remaining substance on any surfaces. Don't scare yourself. Your body has skin for a reason, to protect you from unknown substances outside of your body. So we can talk about opioid overdose reversal drugs that are on the market. There are lots of different opioid reversal drugs that are being given out to public health departments, police stations, syringe exchanges, but there are some that are more effective for people who use drugs and people who use opioids consistently than others. Nalmefene is a 2.7 milligram opioid reversal drug. It is not the same as naloxone. Brand name is Opvi or Zurani. It has an 11-hour half-life. Half-lives, when we're talking about opioid overdose reversal drugs, are important to consider. Having a longer half-life of a reversal drug means that the person who is getting the reversal will be in what is called precipitated withdrawal for longer. Precipitated withdrawal is something that is incredibly painful and hard to go through for people who have opioid-dependent bodies. Going through precipitated withdrawal has been described as having your bones melt out of your skin and some of the worst flu-like symptoms you can possibly imagine. The reason why these half-lives are so important is because they impact how people respond to opioid reversal drugs. If somebody is given something like nalmefene or like Cloxato, which is 8 milligrams of naloxone, which does have a shorter half-life, but it is 2 to 3 hours, they are less likely to want to have someone respond to their overdose in the future. That means that they have a larger risk of having a fatal overdose, which is what we want to avoid. We want to make sure that people who are using opioids feel like they can have a safe reversal that is not cruel and is as humanely possible for them to feel better. Naloxone or Narcan at 4 milligrams is what everybody sees. It is in CVS, it's given out by health departments, it's given out by firefighters, it's very popular and very on the market. That has about a 30 to 90 minute half-life. There's also Revive, which is 3 milligrams of naloxone. That has about a 30 to 90 minute half-life. And lastly, there's a different formulation of naloxone in which it is given in an intramuscular injection, and that is 0.4 milligrams of naloxone. Anything below about 4 milligrams will have about that 30 to 90 minute half-life. This 30 to 90 minute half-life is a good window for folks to be able to get to EMS or get to a safe spot with friends or family so that they can be monitored for any further overdose. How do we respond to an opioid overdose? Well, it is pretty simple. First, we need to learn the signs of an opioid overdose so that we know what we're looking for and we're not giving somebody naloxone unnecessarily. How do we recognize an overdose? Well, it can be a loss of consciousness, unresponsive to outside stimuli. They can be awake but unable to talk. Their breathing can be shallow, sounds like gurgling or snoring. Some people refer to this as the death rattle. They can be vomiting. Depending on their complexion, they can be bluish or ashen. Their body can be excessively limp or excessively rigid. Their pulse can be slow, erratic, or not present, and their pupils can be pinned. So these are all, of course, different aspects of any other opioid overdose. These signs can be symptoms of any other medical emergency, so it's important that we respond with kindness and basis for the symptoms we are seeing. When we are calling 911, we want to make sure that we are just saying symptoms to the operator and saying, I see someone who's unresponsive, I see someone whose pupils are pinned, I see someone who is hurt, so that they have that information to move forward and be able to arrive as soon as possible. So the first thing that we do if we think somebody is having an opioid overdose is we yell. We yell their name, we yell to other people around them, and we try to get them to respond to us. If somebody is possibly just a little too sedated, they may not respond, they may move, they may kind of make a grunt, but they may not respond in an actual voice. The next thing we want to do is, if they are being completely unresponsive, is we do a sternum rub. So that means that we take our knuckles and we push it directly into the center of the chest, and we want to rub up and down. When we are doing so, we want to try and get some kind of stimulus out of them, some kind of reaction. So we've had a situation where somebody is not responding to a sternal rub, so now it's time to act. If they don't respond, we want to tell somebody else around us to call 911. We want to give 2 initial rescue breaths, and then we are going to administer the naloxone. So the first thing we do is we do a finger sweep to make sure that there is nothing obstructing the mouth, and then we proceed with rescue breaths. So we want to tilt the head back and lift the chin up, and we want to give 2 full breaths, and then 1 breath every 5 seconds. We want to make sure that we watch the chest rise and fall when we are giving the breaths so that we know that oxygen is entering. I know what's happening is scary, but I promise that you can do it. It's a very simple procedure, and it will make sure that somebody is safe. So we're going to follow the 3 Ps when we're administering the naloxone. We're going to take it out of the package. We're going to peel it open. We are then going to place it in the nostril. We're going to take the nasal applicator and put it between our 2 fingers all the way down to the base of our fingers here. And then we are going to make sure that it is all the way down, something like this, so that when we are able to, we can get our thumb underneath and push up on the button. So we've placed it in the nostril. When we are placing it in the nostril, we want to make sure that it is in the nostril and pointing to the opposite ear so that it is following the nasal pathway. And then it is as simple as to push. You will hear a click and a spray, and you have administered naloxone. So next comes the hardest part, waiting. We are waiting for either them to regain consciousness, their breathing to change, or for emergency services to arrive. Any of these 3 steps move them forward. But the important thing is to remember that they need to breathe, they need oxygen. So if their breathing doesn't improve, you will need to keep breathing for them. Breath is life. No one has ever died from too little naloxone. We need to focus on oxygen. If 5 minutes have passed while you are doing rescue breathing for them after you have administered the first dose of naloxone, and nothing else has changed, then it's time to repeat the 3 Ps. We peel open another naloxone, we place it in their nostril, and we press the button. It's that easy. You've administered naloxone, you've given them rescue breaths. Hopefully what happens is they either regain consciousness or they start breathing on their own. But let's go over a recap. So we want to look for the signs of overdose. They're unconscious, they're not responding to stimuli, they're vomiting, or their skin color is changing. We want to then give them stimulation of some sort by giving them a sternum rub. They're still not responding. So now we're going to call 911 and make sure that we tell someone around us to call 911 so that we can focus on giving care. We want to give 2 initial rescue breaths to make sure that the person has oxygen. And then after that, we follow our 3 Ps and we administer naloxone. We want to evaluate their breathing throughout this entire process. The rate of breaths per minute for an average adult is about 12 to 20 times. So in that range, it doesn't seem like a lot in the face of emergency, but they are safe and they are getting oxygen. If they are not breathing, we finger swipe. We give them rescue breaths, and then we give them a second dose of naloxone after 5 minutes. If they are breathing, but they are not conscious, we put them into rescue position. If they are conscious and breathing, which we hope happens, then we need to give them supportive messaging. This is what rescue position looks like. We want to make sure that they lay on their side so that they can still get oxygen, but if anything happens, like they vomit, they do not aspirate. And then lastly, why is it so important for us to make sure that somebody has oxygen throughout this process? Is because having an overdose can lead to a anoxic brain injury. During an overdose, if a person's brain has been deprived of oxygen for 3 minutes or more, there's a chance that they can sustain a continuous brain injury. This can have effects on them in many ways. The more overdoses that somebody has, the more experiences they have without oxygen can impact them throughout their life as they continue to have sustained brain injuries. This type of brain injury is called an anoxic brain injury, and it can have lasting impacts on their substance use recovery. We hope that if you need naloxone, you can reach out to any of the SSPs or syringe service programs throughout the state of New Hampshire. They're all listed here. Any of them in your area would love to get you in contact with naloxone and even teach you how to use it if you need some hands-on experience. And lastly, you can also go to the doorways if you need help in recovery. They can connect you with treatment services and referral so that you can start your process in recovery if that's what you're looking to do. They can also get you naloxone and testing strips if you need to access them as well. And that's it. You've learned how to administer naloxone, and you've learned how to care for people who use drugs a little bit more compassionately. We want to make sure that everybody in our community is safe because everybody is our friends and neighbors. Thanks so much for listening and taking the time to learn how to respond to an opioid overdose.
For more information on harm reduction education, contact our Director of Education, Liz Beaule, at liz.beaule@nhhrc.org. Connect with us on social media and visit our website to learn more about harm reduction at www.nhhrc.org. See you there!